All right, my name is Randy Walls, and for my research proposal, I'm going to be discussing pressure ulcer prevention. Okay, what is a pressure ulcer? As many of us know, a pressure ulcer is an injury to skin and the underlying tissue over a bony prominence that happens after prolonged pressure to skin. An evidence-based article in the ICU states there are many forms of pressure-preventing devices available for nurses to use for patients that are at high risk of skin breakdown. The article applies to this research proposal and a unit in southern Indiana because it deals with high-risk patients and ventilation patients. Different measures to consider to prevent pressure ulcers are pressure-reducing mattresses with 2-hour turning schedule versus standard hospital mattresses with no turning schedules. Also, evidence shows nurses must be properly educated on different types of mattresses and preventive measures to make sure they know how to properly use these mattresses. Research also supports using pressure-reducing mattresses with 2-hour turning schedules and having the staff properly educated because research has shown that this has led to less pressure ulcers developing. In this research proposal, the items that will be discussed will be the problem of pressure ulcers, negative patient outcomes related to pressure ulcers, a literature review over the prevention of pressure ulcers, a PICO question, a nursing theory that is applicable to this research, the design, setting, and sample of the proposed research, collection data analysis, and how this research can improve patient outcomes. Okay, problem statement. Pressure ulcers are a universal health problem where millions of people are affected every year. They can be debilitating as well as expensive. Negative outcomes can be the cost. A stage 3 or high pressure ulcer can cost as much as $5,000 to treat it. The chances of developing a hospital-acquired pressure ulcer are 13.1% to 45.5%. And also it involves an increased length of stay. A person that develops a hospital-acquired pressure ulcer can have a stay as long as 1 week to 38 weeks or longer. Okay, literature review. These are different studies that have already been performed that go over pressure ulcers, and these are trials and errors that they've done with them. In the first one, an experimental study was conducted in a hospital on 1,666 patients to decrease the number of pressure ulcers. In this study, pressure-reducing mattresses, supplemental nutrition, repositioning, and standard mattresses were compared. Patient skins were assessed over 3 to 7 days with the Braden scale. The results showed that pressure-reducing mattresses with 2-hour turning schedules resulted in a decreased number of pressure ulcers. And another experimental study in a hospital looked at 468 critical care patients while trying to figure out the best preventive measures to prevent pressure ulcers. In this study, pressure-reducing mattresses, standard hospital mattresses, floating heels on pillows, and repositioning were compared. The nurses used Braden scales and physical assessments 2 times a shift, and the results showed that 94 patients developed a stage 1 to 2 pressure ulcer while lying on standard mattresses without turning schedules. Another experimental study was performed on a 41-bed progressive care unit in a hospital on patients admitted from 2006 to 2011. This experiment looked at creation of a position for a unit-based wound nurse, staff education, 2-hour turning schedules, utilizing pressure-reducing mattresses, and patient care techs helping as well. Staff nurses and wound nurses did physical assessments and used the Braden scale as well as an algorithm to assess the skin. The significant finds were they found that the mean percentage of hospital-acquired pressure ulcers before the study was 18.92%. After doing the interventions, they figured out that it did decrease pressure ulcers. They went to 0% for 17 of 20 quarters in 2011. Another experimental study was in a home health care setting on 100 patients. While trial missed, they did pressure-reducing mattresses with 2-hour turning schedules for 295 days. They performed physical assessments, and Braden scales were used to assess the skin. The results showed 0 pressure ulcers and also improvement in pressure ulcers that patients had already had. And then the last experimental study is the staff was assessed to see how well they knew about pressure ulcers and what preventative measures we could use. So they used 506 patients on 5 different units in a hospital setting. The nurses' knowledge was assessed and they were also educated. Interventions used were Braden scale, physical assessment, and pre and post test. The results of the post test showed a p-value of 0.021%, which means that the staff had an improvement of selecting appropriate pressure ulcer interventions. PICO. A PICO is a question that we developed. The P stands for population, I is for intervention that we'll use, C is comparison, and O is outcome. For this study, we look at patients that are hospitalized and had a high risk of skin breakdown. I was the use of the pressure reducing mattress, O was the comparison of the standard mattress, and the outcome we want to see with the pressure reducing mattresses is a decreased number of pressure ulcers. Theoretical framework. For this one, we use the nursing process discipline theory. This theory meets the patient's immediate needs and it's an interaction between nurse and patient. With this theory, it applies to pressure ulcers because the nurse is developing individualized plans to help treat their pressure ulcers as well as prevent them. By using individual care plans, they can help develop better plans for that patient. Now, if we were to actually present this project and do it in a hospital setting, it'd be a quantitative and experimental experiment. We'd be comparing hospital-acquired pressure ulcers before and after the study. We'd have a control group would be patients lying on standard mattresses with 2-hour turning schedules, and an experimental group, which would be patients lying on pressure-reducing mattresses with 2-hour turning schedules. Documentation by the nurse would occur in the computer. The setting would be a large hospital in southern Indiana with a medical surgical floor. The sample would be patients who are high risk for skin breakdown. There would be 50% of participants divided between the control and experimental group. The time frame would be over 3 months. And we would protect the patient's rights by voluntary consent, letting them know that anything that is used would be only for educational purposes and no names or patient identifiers would be used. Data collection and data analysis. The instrument that would be used would be the push tool, also known as the pressure ulcer scale for healing. This tool was used to observe, measure, and score pressure ulcers, and it was developed by National Pressure Ulcer Advisory Panel. The validity and reliability cannot be measured. However, this tool is considered a best practice tool and is widely used. To analyze the data, they would use independent t-tests, which would compare the number of pressure ulcers before and after the implementation of the interventions, and the SPSS software would calculate the results of the study. In conclusion, pressure ulcers are a universal problem that every unit in hospitals face. There's still a continued need for research to still develop the best research that's going to be out there to help our patients. And we also want to improve patient outcomes by utilizing pressure-reducing mattresses with 2-hour turning schedules upon admission and help prevent pressure ulcers from developing. And then these are my references I used. Does anyone have any questions? No questions?
No.
All right, that's it.